Bonjour, Madame la Ministre.
Hello, Madam the Minister? Yes, hello. So I'm Guy Valenciennes. We have met once. I remember it was during the Congress on handicap, and you were already minister when we met. And I have Fabien BRISARD. And hello, Madam the Minister. I am the director of CRAPS, specialized on social policies. Hello. So when we're looking at this card, the Prime Minister, we have actually remembered several terms from here. Prevention, access to care, and this is actually one of the important titles of your list of policies. And then the third term was evaluation. And I think that with this term, we will probably be able to gain a lot of money, to get a lot of money back. So in terms of the prevention, so what will be the project that you will probably mention on the long run and on the medium term? So for me, first of all, prevention is a tool that is absolutely necessary to the evolution of our healthcare system, but not just the healthcare system, because I believe that the prevention covers a lot of different ministries and a lot of different policies by the different ministries. So we are within a society that is aging. We see different chronic diseases that are getting more and more numerous and increasing more and more. And of course, they are eating up the budget of the social security and insurances. And the question that I'm asking is very simple. How can we age in a better health? So I think that this is the goal that we should fix for ourselves collectively, because first of all, it's good to be in good health, and second of all, because through this we will be able to solve, of course, an equation that becomes complex with aging of our population. So the prevention, many things have been done, of course, by the ministers up to now in terms of the prevention, and by the Minister of Health as well. And the very first important prevention was, of course, the vaccine campaign that was carried out, and it was like the major prevention. And the very last one was consisted of different elements that were also launched. This was this prevention summary that was for 4 different key periods of life, key ages of life, that was not really transmitted or disseminated enough. And I think that I would like to focus on that and to do much more dissemination of this health summary that will be accessible to everyone without additional charge, without additional payment needed. But a lot of actors are working in the prevention. Let's say we have this complementary insurances that are working there, but also a lot of different actors that are doing a lot of preventive actions. But I believe that we have a certain lack of coordination and structure here, but also of visibility as a result of that. And the prevention should be like an umbrella that covers the life of the person from the earliest childhood, because the sport at school is already prevention. This is fighting against physical inactivity. Also, I would say the wisdom of using the screens for children, this is also prevention. Doing it wisely, this is also prevention, because we understand that we have a lot of different issues with mental health, and we're also incriminating a lot the abusive use of screens. So I think that the prevention is something that is much broader than what we could think of today, and it actually deserves to be structured, to be amplified, and specifically to really be part of the life of every single person, starting from their birth and until their most oldest age. So Agnès Buzyn was taking the floor 2 hours ago before, and she was talking about the prevention. So she actually expressed it in the same terms pretty much, but she was not really talking about the healthcare field. And she was very much insisting on the role of the mayors of small communes here in France, because in Paris, where I live, it's absolutely incredible, because we have, let's say, the sidewalks that are absolutely horrible, with all the bikes and all the kick scooters that are passing practically over you on the same sidewalk where you have to walk. Yes, of course. Well, this is, of course, prevention, but also accessibility for, let's say, disabled people, but not just disabled people. because, well, of course, we understand for every single person so that they wouldn't trip on the pavement that is very degraded, but also for people who are with reduced mobility or aging people or older people or younger people. So all of this is part of work. And of course, the public space is also the place of prevention, which is why this policy of prevention is basically foreseen in a very specific way within our ministry, but not just in our ministry, because it must be part of the architecture of a much more global policy that also includes the Ministry of Agriculture, the Ministry of Digital, the Ministry of National Education, and so on and so forth. I will not cite all of them, but this is much broader than what we imagine when we say prevention today. Yes, indeed. I would like now to give the floor to Fabien BRISARD. Probably you have a question on prevention. Madame the Minister, yes, well, in January 2023, we had the study for the Figaro that said that one French person out of two was saying that the access to the healthcare was very difficult. So this continuous lack of care is basically a weight on the French people, but also on the healthcare system, because healthcare professionals are working in these degraded conditions. So François Braun has talked on France Inter on May 3rd, 2022, about the medical desert everywhere in France. So facing all these facts, what is the strategy and the solution that you are planning on in your ministry? Well, I know that all of my predecessors have been working very hard in this field as well. François Braun in particular, they had this approach that was very much territory-oriented and differentiated. Well, me, I am very focused on the local level because I come from the local level. I was a mayor in the rural area. I was in a small city in the rural region, and I really know all these topics related to the access to the healthcare. This is not something that is only found in the rural areas, because we can see it also in the cities, but also on the outskirts of the cities and so on. Sometimes in some cities we don't have enough access to the specialists. So this is one of the major issues, one of the major stakes for all the policies that must be implemented urgently. We already have some tools that are either already created or in the process of being created at the level of the collectivity. Let's say the basin of life, what we call the CPTS, which were created by the healthcare professionals. We also have the local contracts for healthcare and many different other acronyms that most of the people, general audience, do not understand. But what is interesting for me is to make sure that our co-citizens will know what is happening and will know what they really have at their disposal. So we have this real important topic of awareness, of visibility that must be implemented. And I also think that we have to leave our silos and continue living our silos, just as we did during the COVID period, when we did work with hospitals, but also with private sector, with pharmaceutical stakeholders, and everyone was there. They united their efforts so that to give the solutions to the French, because the French had like a real need of all of the solutions during this period, and we had to create a solution for each territory, for each life basin, as we called it, for all of the stakeholders. So of course we have some of it, like the CPTS, that are already very well in progress, but we still need to amplify some things and also to open up some doors and some connections that do not exist just yet. For example, with different establishments for the elderly people, so that to avoid the situation where the elderly person comes to the hospital and has to spend several hours in the emergency service just waiting, and coming out of this emergency service even more tired than what they were when they came there. So you see, this is finally a territorial organization, and healthcare is basically one of the things that are related to the development of each territory. So the development of the territory is not just building roads and talking about employments and housing, but we also have to think about the healthcare system within this territory. The second problem that we have, which is a major problem as well, this is the lack of doctors, the lack of practitioners. Today, of course, we are in this critical situation. François Braun was already telling me this, that we will have to pretty much work very hard for several years before we will have this increase of numbers of students in medicine that will allow us to train additional doctors while numerus clausus is disappearing. So this is a new challenge for all of us. And right now we are calling on all the doctors, nurses, practitioners for help, because all the tools basically are here, but we have to match them at the level of each territory, taking into account their specificity, because we understand that the rural territories have their specificity, urban territories have theirs, and all of this has to be reflected. So when I'm saying that I don't create any miracle, I would like to say that we have the tools and we have the necessary people, but I believe that we have to really put them on projects, respective projects, so that there will be the interests of the professionals, but also of the local elected officials, so that they will be building all together and developing all together the local territories. And these projects must be very solid. And I plan on working on this with everyone. Now, with respect to the access to the healthcare and the quantity of doctors, this is a real debate right now, because today the young generation is working 2 times less, 35 to 40 hours. And this is with respect to the old generation. And we would say that we need 2 to 2.5 doctors to replace those who were here up to now. But we are also forgetting about these nurses that are in training right now. So probably with these advanced practice nurses, we will have more people than one Gabriel Attal is talking about, because in 10 years, they will be coming out of this training. And with all this progress, with the injection of all of this nurses that I have been talking about, advanced practice nurses, but also the pharmacists, the midwives, the kinesiotherapists, we are going even farther here, and the study period is right now shorter. So this will allow us to have enough practitioners so that to cover all of these medical deserts within 2 to 3 years. I completely agree with you. This is what I was telling you. So we basically need to mobilize all the stakeholders. And of course, I'm very much in favor, and it has always been the case for me. I'm very much in favor of the advanced practice nurses, of all of this additional trainings for the professionals, all the professionals who can have some additional trainings. I'm very much in favor and defending them, because I am a doctor as well. I have stopped working as a doctor 15 years ago, but even back then, I can tell you that it was not very easy to defend this, even though I was doing this. But I understand that today this is an absolute need. In terms of the mental health, we see that this very important, there is this very important difficulty, and this is a big challenge in our country right now. And of course, we have to train these advanced practice nurses, so that to be able to probably at least do the primary care for the patients, and then to have a doctor that will be providing a much deeper diagnosis and treatment as well. So we understand that we have to save some medical time for the doctors, meaning unload a little bit them from the administrative tasks that are taking a lot of their times uselessly. And we really need to continue building things with all of the professionals, developing things. I was very much impressed during the COVID-19. I was very much impressed by this absolutely incredible mobilization of the pharmaceutical professionals, pharmacists. They had a very important role, and I was very much impressed by the mobilization of pharmacists, but also of the liberal actors. And they have this essential essential role to play here. So they came into this project based on their willingness. So we actually have the professionals of a very good quality on our territory, but they have to work all together. So we have to stop working in silos. We have to work all together and start building on each territory, at the level of each territory, the response that will be very much adopted to its specificity for the primary care, for the secondary care, and of course for the emergency services, for all the healthcare that has not been foreseen, which is also a very important topic on our territory, a big problem. Now, to go back to this sentence by our president, that we are spending too much money on this in this country. So when we're looking Sweden, and we see that we have 2.1 hospitals for each 1,000 inhabitants. In France, we have 5 for 1,000. So the problem is that in Sweden, we have 72 years, the average lifespan of people. And in France, we are coming to 65. So we actually have too many hospitals. And I actually did the study on surgery with CHAM, and we understand that we have this very small hospitals. So we have to close the small surgery hospitals and to transform them into the health cities or establishments. So we actually have to pretty much turn around all of this, but we can no longer keep the system that is here today because it does not work anymore. So what do you think about it? Well, look, we have had some progress in this field already with these proximity hospitals that were deployed. So this was actually done in order to make sure that the small hospitals with the activities that could technically become complex for, let's say, surgery, transform themselves into the proximity hospitals with probably a less heavier medicalization, but they're still offering very important services, because what we are lacking today a lot in our country are these upstream beds, and all the emergency service practitioners will tell you this. That's what they tell me, and I know how this system works. So we have to make sure that with all of these proximity hospitals, we will give them this mission of the public health care for elderly people most often, because elderly people are always here, and to make sure that they would be a great compromise between a much bigger hospital that needs to also do some active surgery, but cannot really keep these people in the hospital on the beds for a long period, and the nursing homes that are much less medicalized. So we basically need these proximity hospitals. They are being deployed right now, and I believe that this is also an important response, so that to unload all the bigger hospitals that need the flow of the patients, and also to preserve an access to the health care for the people who really need it. Yes, and probably very last question that I would like to ask you. When we are looking at the expenditure, we are spending approximately 250 billion for the consumption, and we actually say that in most of the country we have 20% of all the laws and acts that are useless. Well, in France, the last time when I was looking at it, we saw that for all the actions that were carried out, we had even more than 20% of actions that were useless. So I think that, well, we're doing sometimes all the different assessments and so on that are not really needed. So I think that we are doing a lot of practice that is unnecessary, and the results in the small hospitals are really terrible. We have 3 times more death when we have 10 similar acts in a hospital, and when we have 50 plus of similar acts in a hospital. So we actually need to really look at this situation. But by doing this, we are basically also doing some savings, basically getting some money back, because this will be 5% of all these goods. Even 5% of all these goods that are consumed uselessly are already representing 10 billions. So if we are talking about surgery for just one act, we're looking at the rate of the death, the rate of the surgery, of the relapse or of the secondary surgery, repetitive surgery and things like that. And the fourth question, the rate of the transfer to another hospital for the comorbidities and complications. I think that this will be very, very easy in the CNAM. Well, basically, we can unite all the mayors and all the specialists and explain them this and say to the mayors, we have to stop doing these surgeries in your hospitals. We will transfer all the diseased people, and it will give us the money back and the better results. Well, yes, of course, you are right. These are the questions of structuring and restructuring, reorganization of the establishments. And this is something that was already being implemented, because we had some small maternity services that were closed, for example. I think, well, what is really difficult is that it is not heard by the local elected officials and by the population. So that's a real difficulty. And me, I share your opinion. A hospital where a surgeon will be doing very few surgeries represents a risk for patients, because the surgeons need to practice, and practice allows us to diminish the risks and to avoid them. So here we are facing the topic that I believe is first and foremost the topic of safety for the patients, and of course the lack of care or treatment, and we have to tackle it. But I must admit that it's a little bit difficult to convince a mayor. Well, I haven't really tried yet because I wasn't Minister of Health before, but I can reassure you that I can see the reaction of some elected officials whenever we are trying to probably change or remove some services from a hospital. But definitely the average, as you are saying, that you were saying before that, the average or the means for us is to basically transform these establishments that will still have the stuff and be doing useful activities on a certain territory. But we will have, let's say, the beds that will be occupied for a longer period, and we will be doing prevention activities and things like that in these hospitals, but not the very complicated surgeries, and it will be very useful for the territory. Yeah, and we can also add to all of this, the immediate medical centers. So the mayor is not really operating things here, right? The opposite, I would say. Yes, indeed. And I will try my best to persuade these mayors, because I am convinced of what you are convinced. Oh, yes, indeed. We're following you on that and cheering up for you on that, because the poorest are being operated, are being having surgeries in there. The others who are informed, who have more means, are really fleeing this hospital. So we have this fleeing rate, as we call it. And this is absolutely incredible, because it's up to 95%. So people who are living in the city, they will not be getting a surgery there just because they know what the market is and the risks and things like that. So they will just go elsewhere. So without offending people, we just need to make them understand this. So thank you very much, Madam the Minister. Thank you very much for this interview. Thank you to you, and I wish you a great end of Congress. Thank you.